Hey everybody, my name is Ryan Shear with 11 and Now. This is Ryan with Optimized Health and Integrative Medicine, and this is Brian Hash with Boattown Brewing. Now, we've had this concept for a show for quite a while called Men, right? Where we just talk about dude stuff. It's not, sexist, or we're not excluding anybody. It's just men and women are different animals. Men have a way of talking about things, and today me and Brian are the core hosts of this show going forward, and we're going to try to evolve that. And then what we did today is we got our good buddy Ryan Rogers here to come on, and we're going to talk about some men's health stuff, amongst other things. And we are completely live, so feel free to drop your questions, leave comments while we're live. We'll try to answer those. And what could go wrong, right?
I just found out 3.5 minutes ago that this was going to be live, so I was like, what could possibly go wrong?
If this Ryan has to edit anything else, I'm gonna go stand in traffic.
Okay. All right. So
we're gonna go live.
Flying without a net.
Yes, we are gonna go live. How are you today, my friend?
Living the dream. Couldn't be happier.
Nice. Anybody that follows me or 11 Now knows that you have a show here called On Call.
On Call.
And once a week we get together. And thank you. And we film some medical stuff.
Interesting medical topics. Sometimes we get those from comments from viewers. Sometimes we kind of, again, fly by the seat of our pants, but we're never live.
No, this is, the live thing is a Ryan Shear thing. It's one of those things that that's the thing I want to do because it's less work for me.
I actually prefer the live just because there's no way I could go back and change anything if I wanted to. So whatever you see is whatever we got. And that's why I prefer doing the lives for Boattown and stuff like that, because there's no chance I could change it. It's out there.
And you do well for your lives for Boattown, but you're also the co-host of Good Morning Lebanon.
I am, and that is live as well. So I just, it kind of caught me off guard today, but I prefer it.
These are real beads of sweat.
Yeah, no, Ryan's like, oh, no. At least people will know that you blink.
That's true. Yeah.
People will know
I am not a robot, I promise.
Right.
I swear.
You can try all you want, but you're going to blink before this is done.
I promise I will blink. Yes.
No, it's hard. Like when you do content, when you film content, when you're up here, and I especially like the dumb stuff that I do, you can't really be right or wrong. It's just stuff that I do, right? But you're like up here doing medical advice, which can be wrong.
Right. And you don't want it to be wrong because you're trying to steer people towards, helping themselves or helping other family members and things like that.
And believe it or not, alpha-gal tended to be a very contentious subject as in the comments and as we talked about it.
Yeah, we're seeing it more and more now. I think, from at least my perspective, there's a lot of things that go on in the gut, some dysbiosis, things like this that sort of cause or have the ability now for these things to become more prevalent. So we're seeing it more and more in the office, and we're seeing it more on a more prevalent basis. And it's, something that certainly people deal with. I mean, you probably know people that have alpha-gal.
I do. And what's interesting to me is it's a little bit different for every person.
Yeah.
Whether they're very young, I know a very young lady, 6 or 7 years old, and then some folks that are my age and in between. And it's very different how they react to different things, to different foods and all that.
Yeah. If somebody has alpha-gal, tag them in the comments. Because I mean, this show is we're just going to talk about stuff. We didn't really have a plan here, right? Ryan, what is the biggest thing? So let's kind of transition into some men's health topics here.
Yep.
That's why we brought you on here. And it's two very healthy middle-aged. Sorry.
Right.
No, you're my doctor. How about I am? But anyway, what are some of the things that men commonly face that would be just specific to men? I mean, outside of testicular cancer, that's kind of a given.
Right. I think we see a lot of hormone optimization just in general public, men and women. But for men, It's the hypogonadism. It's the low testosterone.
Okay, what is hypogonadism? That sounds like something I want.
Well, basically, no, you don't.
Okay,
no.
I mean,
Say no to hypogonadism.
But I mean, just by saying, hey, hypogonadism.
Well-
I got gonads; they should be hyper.
Right.
You know.
It's hypo. So your
Okay.
gonads are not functioning at the
Gotcha.
highest efficiency.
Oh,
And
gotcha.
this happens as we age over
Okay.
time. Your testosterone levels just drop.
Yes.
And so that can look like fatigue. That can look like, brain fog. That can have implications with erectile dysfunction. It can have libido issues. So
Yeah.
lots of things can be playing a role as far as low testosterone or hypogonadism.
Okay. So
yes.
okay. So no. Okay. We're back to I don't want it.
You're right. You don't
Yeah,
want
you
don't
don't.
want this. But the good news is that even though that you don't want this, it's easily fixed. It's testosterone replacement therapy, it's injections, it's troches, which is basically like a lozenge that you put in your cheek and you
Yeah.
kind of cheek it and it absorbs into your buccal mucosa. But easy
Big words. For
sorry,
what?
into your
Ryan, you're,
gums.
I'm on the show with you now. You're going to need to speak in smaller words.
Deal.
Okay.
Drop pictures
I-
if we need.
The
Basically, it absorbs into the skin of your cheek.
gotcha.
Right.
Okay. And so those are different delivery methods that we can get their testosterone back to normal levels.
Right on.
And for somebody that I do testosterone replacement with you guys. Yeah. So one of the things that I can absolutely 1,000% attest to is that that I can 1,000% attest to is it is a thing. Like you don't even know it's a thing.
Yeah. Because
it happens so gradually. It was one of those things that I went through the weight loss journey with you. Did some Ozempic, did some other stuff like that to help the heart out a little bit. And you kept trying to push me testosterone. I didn't want to do it. I didn't do it. So I started taking testosterone, and it changed everything. It changed. I always feel like how you view the world and how you look at the world and how your brain tells you to view that world is how you perceive the world that day. And some days it's good and some days it's bad. And I definitely was doing more bad days than good. And after we start doing hormone replacement therapy and those things, it was legit just a life-changing experience. And it's weird how we as men, that's such a core thing that we identify with, because to walk us through, like with testosterone, you start out when you're a little child, you don't really have a whole lot, and you go through puberty and it excels.
Right.
And then what about that fall off, and why is that fall off so important in men's health?
Well, there's lots of theories, I guess, that sort of go into why our testosterone sort of falls off as we age. I think a lot of it has to do with activity level. I think a lot of it has to do with adipose tissue, like truncal obesity, insulin resistance, and overall just that decline happens most of the time just because, again, there's other exogenous factors or factors from the outside that are sort of causing our testosterone to drop.
No, go ahead.
Okay.
I'm running the show from up here.
Oh,
too.
I see. Yeah.
That was me. So Brian, you're not on any testosterone.
No,
therapy.
I'm not. But it sounds like maybe I ought to try it just to see, because I experience an awful lot of those things.
Yeah.
I'm the oldest one of us up here, I'm sure, by a ways,
Yes.
and I feel all of those things.
Yeah.
So maybe that's something that would help.
The biggest, complaint or biggest sort of concern that when people come in to see me for this, it's the fatigue, it's not sleeping, and it's rest. Right. Those are the big things that I think people tend to come to talk to me about as far as the symptoms that they're feeling. And it's easy to test. I mean, this is a blood test that takes, probably a day to run in the lab, and we get results back, and I can tell with a very high degree of certainty that if your testosterone is low first thing in the morning, most likely it's going to be low as the day progresses.
Right.
We have Joe Siemens watching at home. Thank you, Joe.
Hey, Joe.
Yeah,
hey,
we all
Joe.
know Joe. We all
How
know
you doing,
Joe.
man?
Joe's great. So the testosterone thing. Let's talk about another problem that a lot of men face, and that is hypertension, high blood pressure, blood pressure issues. Yeah, I'm not saying it's specific to men, but I do understand, and correct me anywhere that I'm wrong, because I did not go to school for any of this stuff. Is that high blood pressure and stuff like that is more specifically male?
No, not necessarily.
Okay.
I mean, for heart disease is men and women, but more prevalency in women.
Okay.
But in men, I think the statistic is it kills about 350,000 men per year.
Right.
And that's high blood pressure, that's coronary artery disease, that's congestive heart failure, all those cardiovascular related diseases.
Right. As Bill Burr would say, we're in the drop dead years.
Right. Well, you are.
You're not there yet. Oh, okay.
I don't know. It's 47
Well,
drop
hey,
dead years.
I mean, at this point, yeah, especially if you have some underlying
If we're lucky.
health issues.
All right.
Yeah.
So if Louis C.K. has one of my favorite quotes about deaths. Like, what happens when you die? He goes, lots of stuff. It just doesn't have to do with it anymore.
Right.
So, so what are some of the signs? Because they say about high blood pressure, it's one of those things. It's like a silent killer that you don't really have. But I know my ears ring. Like
Sure.
I do feel when my blood pressure's high, like my ears ring or I don't feel great or whatever. And then when it actually goes down to normal or low, I feel like trash then too.
Right.
So
I mean, you have to know you, right?
Yeah.
So being sensitive to what is happening inside you, I think is an important part of that. Like you said, your ears ring. I will sometimes get flushed, right? And I'll feel like my cheeks are warm and that sort of thing. So it is a silent killer because a lot of people, men my age, your age, we don't go to the doctor regularly.
Right.
So we don't have those screenings. We don't have those stop gaps to sort of look at, high blood pressure. And a lot of times people will go to the doctor's office and they'll say, hey, listen, I've got like white coat hypertension. So their blood pressure will be consistently
So explain
elevated.
white coat hypertension, because that was a thing, and I just couldn't see. Like you put the comment on the screen, I just can't see that far because I'm old. So, but explain white coat hypertension, because that was a thing that blew my mind. Right?
Yeah, white coat hypertension, white coat syndrome. But basically, when you go to see a medical provider, any medical provider, your blood pressure raises because you don't want to be there, right? And so. People get antsy. They don't want to hear bad news. Doctors are not considered to be, a place where people go to have fun, right? So basically nothing good, right? Unless it's a prostate exam. But anyways, the answer is that most of the time people sort of experience these types of symptoms because they're there and they don't want to be there.
Yeah.
But what we know from a statistical standpoint is that if you get into your doctor's office and you have 3 measurable elevations in your blood pressure, chances are you're probably walking around with high blood pressure. So this white coat syndrome, this white coat hypertension may be sort of that scapegoat that you can kind of skirt around getting started on blood pressure medicines. But truly and honestly, you should probably check this at home to see what your blood pressure runs.
So when it comes to high blood pressure, what are some of the effects? Like if I suffer from high blood pressure, I don't feel my medicine, I just let it have its way with me, right?
Yeah.
What's going to happen to me?
Well, over time, it's not going to happen like this, but over time, you're going to injure the inner lining of your blood vessels. It's called the intima. And over time, plaques can form, other things and it will cause, if those plaques rupture, that can cause a blood clot. Blood clots can cause strokes. Blood clots can cause, obstructions in coronary arteries, and that's a heart attack. Pulmonary emboli, these sorts of things. So it can cause, a lot of downstream effects, retinopathies, things like this. So over time,
retinopathy, what is that?
Basically, injury to the vessels of your eye, so causing,
nice.
Blindness or causing vision changes.
But as I just say, I can't see.
But over time, that's the concern, is that it can develop into bad things, but it's not necessarily going to happen sort of like in that moment. You know what I mean? And so we have to be cognizant of high blood pressure because over time, if it goes unchecked, those are the injuries that can happen to the inner lining of the vessels.
Right. Do some people run? Oh, sorry. Go ahead.
I was going to say, I think when it comes to this in men's health, though, there's also kind of this underlying mental health piece, and maybe not mental health, but mindset piece of you just keep going.
Right.
I feel like crap. It doesn't matter. You just keep going. And doctor's only going to tell me bad or tell me to stop doing things that I love, like, cigars and whiskey and steak. And so I think there's a mindset piece that goes along with that, especially, and I don't know how it is for younger people, but for our age, I think, and older, it's just one of those things where you put your head down and you keep going. My dad's dad was changing the oil in his car one day in his driveway and had a heart attack, and they hauled him to the hospital, and he spent 2 days there, and they kicked him out, and he went home. And you know what he did?
Died.
He finished changing the oil in his car.
Oh,
this is the this is the role model that's kind of been set before us a little bit.
But I think that's a whole nother subset conversation of where as men, that's what we're supposed to do. Like that,
Right.
that is what we're programmed to do.
I mean, I agree with you. Couldn't agree with both of you more. And that happens. We see this all the time because, again, right, they're coming because they're having an issue.
Right.
And a lot of times that issue is their wife telling them that they need to go be seen because they're having some
Yeah.
issues, right? And
Right.
so those types of scenarios, I mean, again, you have to have these checks and balances because a lot of times, like, your father was, fortunate in that he could have dropped dead underneath that car while changing the oil.
Right.
And my father-in-law had the same sort of event in that he was with somebody and recognized what was going on, took him to the hospital, and sure enough, he had a stent. He had a blockage in one of his coronary arteries. But,
Right.
I see it in the emergency room when I was in the emergency room, saw it all the time. Younger and younger and younger people that were developing these types of issues because they weren't being seen and they weren't taking care of themselves. So it's important, again, to get in to see somebody to sort of talk about these things and know that, again, lifestyle modification goes a long way before we even kind of put you on medications.
Right.
Everybody, we are live. If you're in here watching, drop a comment, say hi. Got questions for Ryan about health. Ryan, just take a second, give a little bit of your qualifications. You like do things to people?
I do things to people. No,
Okay.
I'm a physician assistant. I've been practicing for over like 15 years at this point. Practice medicine mostly in acute care settings, so like orthopedic surgery, general surgery, emergency medicine, gastroenterology, and practice medicine for the Army. I'm a commissioned officer. I'm a major in the United States Army. I've been deployed a couple times. Have done some, combat medicine in the same token. And I think, from now, I both work locally here in town and have a business called Optimized Health and Integrative Medicine that my wife and I started over a year ago. And we try to lean towards functional medicine and trying to find the root cause of most issues. And a lot of times, again, we can kind of bring that back to gut health. We can bring that back to, hormone optimization. We can bring it back to testosterone optimization. But, we're very lab heavy. So we want to make sure that we're seeing labs to sort of guide us in terms of how we manage and sort of fix some things.
And if you have questions for Brian, give us some of your qualifications.
I don't know what qualifications I have. I've just been around a long time. I've
Guy
seen a
makes
lot of
beer.
stuff. I know a lot of things. I know how to turn water into beer. And
Praise God.
I
Yes.
know how to turn a space into a party. So there you go.
Yeah, and the reason why I want to host this and do this men's show is because, like I said, it's just what it is I think there needs a place to come here, because the other conversation I want to have with you guys is that it's been really prevalent. If you guys watched the interview that I had with Sarah Ice, very lovely lady, by the
Mhm.
way.
Yep.
She's youth counselor. I can't get it right. There's a bunch of initials or whatever, but she deals with youth mental health
Mhm.
over at Compass Health.
Mhm.
And men, I think, and tell me if I'm wrong on this, because we constantly bottle up feelings, because we constantly refuse to deal with any sort of emotion, that it can affect your health and stress levels, cortisol levels, and all of those things.
Oh.
So how much role does it take in mental health? Because men actually feeling things, going to therapy, getting all of that worked out, stop like punching things in a garage, does that go to having a better physical health?
Oh, I mean, absolutely. When you think about like mental health, for instance, I mean, there's more serotonin receptors in your gut than there is in your brain, right? And so bowel issues, right? Constipation, diarrhea,
Right.
those sorts of things certainly can be affected by your stress level. Cortisol, and you know this, when somebody pulls out in front of you when you're driving
Right.
down the street, what's going to happen? Your cortisol levels are going to rise.
Right.
What does that do? Causes high blood pressure, causes your pulse rate to increase. All those things sort of play a physiologic role from a mental health perspective. And mental health, again, you guys know this because I'm sure you've kind of had to deal with this, but
What are you saying?
6% of men experience mental health and depression, anxiety, all these things. And goes back
Right.
to what you were saying about your dad. That's not something that we're supposed to talk about.
Right.
Why would we want to talk about our
And
feelings?
And don't downplay punching something in the garage, because that can be a great way to
Yeah.
relieve
absolutely.
stress.
Yeah,
I mean,
absolutely.
You know,
as long as it's not the cat.
Or-
It's cat. As long as it's not the dog, cat's okay.
Yeah. But so it's been a recurring topic in my journey to be healthier and to be a better person and to be a better human, to take care of that mental health and, and kind of help in that struggle. If you're watching, tag some dudes, tag some guys. Come on in. Also, I want to talk about dry cleaning for a second. Premier Dry Cleaning has its huge.
Well, that was kind of a
look.
We did one of those. It's
You
kind
know,
of a thing there.
Dry cleaning.
Stick
You
with us.
can't dry clean your arteries, but you can dry clean your clothes.
Oh,
At
if I
Premier
could.
Dry Cleaning, they're having their grand opening this Friday. This Friday, they're having the grand opening and free food from Tees. It's hot dogs, hamburgers, and stuff. So just stuff we're not supposed to eat, but we're gonna go eat. Look at Ryan.
Everything in moderation. Everything in moderation. Listen.
Look at Ryan. He's like, I try.
I just
so
talked about
hard.
the stuff. but
Yeah.
I try so hard.
Enjoy your hot dogs and
And
hamburgers. I enjoy a hot dog. I enjoy a hamburger.
I'm
Listen,
sure you do.
I like a hot dog.
Thank you. I walked right into that one.
Yep.
You really did.
For
you really did. But we're enjoying the show. We're enjoying doing this. I think.
Having a good time.
So.
Oh,
yeah,
comments,
so
comments,
let's see what
comments.
those are. Abby. Okay.
Do
Do you men know where I can find
the blinker fluid at O'Reilly's?
Love that you're talking about men's mental health. Abby,
So just ask the guys at the counter.
Yes.
They will be very appreciative that you did,
yes.
as well as the left-handed screwdriver to install that blinker fluid.
Yes, yeah, you will need that. There's an that's just somebody tagging stuff. And Joe, put Joe's comment back up there. Joe's been a huge supporter of everything that we have done here, and I got to give the guy a shout out. Just a dude listening to dude stuff, talk about dude stuff. All joking aside, it's an important topic. The stigma says all too tough to worry about this stuff. And just so you know, to be fair, we're gonna have a women's show. We'll have a women's show. I just need to find the hosts for that. My wife, shout out to Sarah running the board. My wife's back there going, "What? Yes. I kind of already have one, but we're gonna figure that out." So, but yes, the women's show is probably if enough of you comment and do whatever. So
You're asking enough women to comment on the man show to make sure there's a woman's show.
Yeah.
I think you got something funny going on.
Look, Abby's
there.
watching.
Abby's
watching.
Yeah, but that's
My
because
wife's over here running the board. There's
Abby's
women
awesome.
watching.
Yeah,
I'm hot. People are watching me.
if you say so. Look, it's your show. You know, it's
of
your
the
party. You
beholder.
can cry if you want to. I'm fine.
Look, we all know it's him. Okay?
Yeah,
we all know they're
he's the
teasing
guy.
him. All right. Well, I think we're going to hop out of here. I think we've kind of overstayed our welcome. But, but
With that last round of stuff, yeah, I think so. Ladies, we're
Boattown Brewing. Do that camera right over there.
Yeah.
Boattown Brewing. Oktoberfest is still got their mugs going on. You can get one of these and get a full of Oktoberfest.
you can.
You can tell them the price.
Oh, yeah. So Oktoberfest mugs, we've still got probably a couple dozen of those left. If you haven't gotten one yet, it's $20 full of beer, and bring it back with you. You get $1 off every pour of Oktoberfest until this year's batch of Oktoberfest is gone.
Ryan, do your pitch.
Optimize health and integrative medicine, functional medicine, where we kind of try to find the root cause of most issues. Come give us a call, 417-533-4355.
And Lebanon Now, turn on your internet on. I'm everywhere. So, that's kind of how that works.
It's true.
Right? So thank you again to Sarah. Thank you again for Dry Cleaning for our sponsor. Thank you for Ryan for giving us time
My
and
pleasure.
coming on. Thank you, Brian, for
Hey,
coming out today.
Thanks for having us.
All right. See you next Tuesday.